New videos every day.
Does your ass hurt? Well, it could be your psoas. Hi, my name is Ron Vaughn. I'm a sports massage therapist. My business is Athletic Tune-Up Professionals, and we deal with sports massage for athletes and the everyday weekend warrior and everyday people. But today, I want to talk to you about your psoas muscle and how it can help you get some relief from your back problems and just running and all that jazz. This is Kate. She's going to be my model today, and we'll show you a proper, different than what most other therapists do as far as getting to the psoas muscle, and it's more effective. The psoas muscle, as some of you know, it's your stabilizer as far as your core. It helps your balance in your when you're running and then when you're sitting down a lot. It's affected pretty much everything you do. So today I want to kind of focus on that, and just I want to show you kind of like a picture, get an image idea of what it's like. It's, you know, it attaches on the origin is right here in the spine, the lumbar area, and it attaches down to the lesser trochanter of the femur there. So a lot of you have that problem, and I just want to show you how to kind of work that out and release some of the tension and help your back or any kind of, you know, butt problem, butt pain you may be having, and help you to just get some relief in your back. So this is Kate, like I said. She's ready to show. We're ready to demonstrate with her. So I'm gonna have her lie down, and we're gonna get started. All right, here's my my specimen here. So a lot of people go through the abs to get to the psoas muscle, which this is the origin of it, which is a good place to do it. Yes. Another place that people that usually doesn't get worked in is right between the legs on the femur. So what we're going to do is going to demonstrate that, because a lot of people already do this. So we don't need to reinvent the circle, reinvent the wheel, I mean. So we're going to have her turn her side, and we're going to show you. So the psoas, you know, attaches up here in the lumbar area, comes through the pelvis area, and attaches down here in the femur area. So what we're going to do is I'm going to show you how to just actually hit it, and you just want to kind of find it. Best way to find it is start from the knee, work way up. You have the adductors, and then you'll find the attachment for the psoas, which is about right in here. How's that feel there? Yeah. So pretty much you just kind of, you know, just work on it. You want to see if you can feel any scar tissue in here. If it's really tight, if it's dormant, and you just kind of want to just kind of knead it and kind of break up any kind of adhesions that may be in there. And the goal is to get the range of motion. So if I get the muscle to move, then I know the muscle can have range of motion. But if the muscle doesn't move, the muscle cannot heal itself with that range of motion. Are you okay? It can be very painful. I've been working on her, so she's not as bad. There's a lot, especially like sprinters. A lot of people who do running, sprinting, they're really tender in this area, so you gotta be careful when you go in there. But yeah, you can just. So she's moving pretty good. And then you can also the adductors, and you also get some of the quad. You kind of separate them here to help relieve some of the tension from the psoas as well. So this way, I could also push it away from the bone here, kind of like deboning a chicken. And some people are so tight it feels like beef jerky. So you want to. So with beef jerky, if you put water on the beef jerky, it gets all soft and pliable again. So that's what you want. So I'm also getting some of the adductors here and getting all that. So another area of the psoas muscle, we already targeted here, and people already know about this one. One area that a lot of people miss too is the psoas comes through this area right under this ligament here, which is the inguinal ligament, attaches from the hip bone to the pubic bone. So if this is real tight here, this psoas cannot slide like it's supposed to slide. And so I'm gonna show you how to kind of release that, so we can get this whole muscle to get its range of motion, so your client can have relief and straighten up their core and balance and agility. All right, So as I was saying, the inguinal ligament attaches here at the pelvis bone here. It goes down to the pubic bone, which is right here. Be careful when you go down there. It's a very sensitive area and personal area. So this ligament here, it gets tight, so you can loosen up the inguinal ligament here. You can also loosen it up down here in this pelvis area. Now remember the pubic area, the abs attach here too, so you kind of have a whole area you have to be aware of. So right here I can feel the psoas muscle. So all I want to do is just kind of rock it back and forth, kind of get it to move. Because like I said earlier, once the muscle is moving, the muscle can function and you can strengthen it and help it get better. Ooh. Of course, there's the good thing about the human body, there's usually two sides to every thing, so you can compare. And usually this pelvis, if the linguinal ligament is tight, it will kind of shift in, and so you really have something to work with. So by comparing them, like this side is loose and this side is tight, so I need to go over there and loosen this side as well. But ooh, man. And so sometimes there's scar tissue on this pubis bone area here, and so you got to release all that and get that going. And so you also have, not only do you have the psoas muscle here, but the iliacus is in here as well, which all come together and run down here. So, okay, another thing about the psoas muscle that you need to think about is if this is being pulled in here, see what it does to the leg? It kind of rotates the leg in. And so when you do that, it affects your whole stride and your whole gait. And because if your knee starts going in, then you start having problems with your hip, your feet start bothering you, and your whole body gets off. This side starts to compensate. And so that's another reason the psoas is so important to get release and get some relief. All right, so trying to wrap it up here. There's so much to talk about the body. It's so awesome. Just a couple of key things. Remember the psoas, if it gets tight, it's going to make the pelvis tilt forward, right? Which also pulls on the spine here, which is on the inside of your lumbar. So it makes you, it makes you tilt in and lower back pain. So that's one reason I'm talking about it. And also that leads up to it, when you work with the psoas, you also got to come down. And there's a pes anserine, which is the adductors, and you got a quad. The muscle comes across here. It's sartorius. There's so much that we could talk about. I can't. So the future videos we'll talk about it, because I want to also talk about preventing knee problems, knee pain, and this is just the beginning. All right, thanks again for watching. I hope this was a lot of information for you. Send me a comment if you have something that you didn't understand what I said, or you didn't like what I said, which I get that a lot. Just contact me. athletictuneup.com is my website, and just email me, contact me any way you can. Thanks so much, and have a good day.